Welcome back to the channel and RevMD podcast. So today we are going to talk about erections and a potential new over-the-counter topical Erexon that might be used for erections. And how did we come up with this topic?
Like some of our more fun topics we discuss here, it is brought up by our camera guy. He's always searching for something or another, right?
Correct.
And this one was over-the-counter erectile dysfunction creams, apparently. So
it's a hot topic for Instagram,
that's what he said. It was all over TikTok. So whether it's all over TikTok because that's his algorithm or it's all over TikTok because it's a fad, who knows? But we're going to learn all about it today.
It seems to me like it would almost be an icy hot.
Well, that's what I said. I'm like, when you read about it, so this is a topical gel that uses cooling and warming, right? Evaporation of the cream, because it's not a medicine. There's no active ingredient, but it uses evaporation to cool the top of the glands, the tip of the penis, and then warms it back up. So when we're talking about cooling and warming, I'm like, what about icy hot?
Correct.
And I will tell you, he jumped right on that one.
Yeah. Oh, he knew that he was not advised to use that one. So therefore, we'll talk about Eroxon and the effects and how it works and whether it works, the studies, how it came to be so popular. And should you buy it? So Eroxon is the name of the over-the-counter FDA approved product. And again, it is over the counter. So I'm not sure exactly how often the FDA actually approves those over the counter. And it's not a medication. It has no active ingredient.
Nope. It actually falls under medical device.
Yeah.
So this is a topical cream that falls under the medical device category.
So I guess that's why there was some kind of approval needed, but I'm not sure. I'm not sure about that. I'm a little confused by it because it seems to me like it wouldn't be a medical device, but it's a medical device for some reason, and it's not using a pharmacologic effect, and it doesn't have an active ingredient. It's just a physiologic effect that you mentioned, Faraday, that has this cooling and then warming effect.
Exactly. So it uses physical evaporation to stimulate a response versus a pharmacological medication to stimulate a response.
Yes. So it's an evaporative response and a medical tube device. But go figure. So anyhow, it's an FDA approved potential game changing for topical ED treatments. I'm not sure how many topical ED treatments have really been out there and very effective. There are lots of supplements that men will use. But again, is it worth spending your money for some things that may or may not work? And again, I think opening those conversations up with physicians or providers or offices like ours that actually offer solutions and actually opening those conversations for whether these, and our patients often bring us ideas on podcasts.
Right off the bat, anyone out there listening to this that it's actually tried this, please, please, please leave a comment. I will read every single one because I am very curious, because what I'm finding on Amazon reviews, right? Because our cameraman has not purchased this yet. He has not tried it yet, at least it's none that he's fessed up to.
And it's very hard to find.
And so I go on Amazon, and currently it's running $100 for 8 individual use, I guess, little vials, right? So each one is individual. It says on there, 0.3 mLs, which is a pea size. So you're supposed to only use 1 vial per use. And there's 8 of them for $100. When I look at the reviews, they are all 1 star. It is like snake oil, doesn't use, it actually burned, it did the opposite. So it's pretty negative on Amazon, usually pretty trustworthy reviews, but even those sometimes I think are paid reviews too. But you would think you'd see more positive if that was the case.
Well, that's why it'll be very revealing to get comments back from our viewers and our listeners, because we did a previous podcast, and if you haven't seen it, look at PyGam. That was also something that our patients brought us as a question, whether that worked to increase ejaculate volume. And so we looked at reviews for that, which were fabulous.
And a lot of them.
And
positive patient feedback on a regular basis with that one.
And consistently across our channel, the jury is in. that it works because the comments and reviews and feedback from our patients is consistent with the reviews on Amazon. So it'll be very interesting to get your feedback for this one.
Yep. So this is, like we said, a cream or a gel. It's a gel. It's a topical gel. You use a pea size. You apply it to the glands on the penis or the head of the penis. You rub it in, and within 10 minutes, it's supposed to take effect. That's all really that I can kind of get from the website. When it looks about who is it safe to use on or who can use it, there doesn't seem to be any contraindications for it, that it can be used. It doesn't negatively affect condoms. It doesn't negatively affect sperm count
and viability. But again, I don't think that there's studies. So the only studies that we could find, and again, were two phase 3 studies that showed one of them was versus placebo. The other one was versus tadalafil. So I don't see studies that say anything about sperm and viability or rubber or breakdown of that or vaginitis and effects such as that. Is it good for oral consumption if anyone wants to have oral sex after it's applied? So there's lots of questions out there and only two phase 3 studies that are very small. And again, it's a topical, no active ingredient that cools and then warms, maybe affects the nerves in that way, maybe some nitric oxide production that we read in a couple places, but that was related to actual other
pressure,
stimulation.
tactile on top of temperature. So it was multifaceted for it to be an actual nitric oxide response. Nothing really indicated just putting this gel on alone would do that.
Correct. And so I've seen a lot of things where there, for instance, would be a laser for sexual regeneration that we do that shows collagen histologically improving, and yet it will be, well, maybe that was related to a heat, not the laser. Well, this is like no histologic effects or studies that support
Nothing that it
nerves, blood vessels, or again, nitric oxide production. So again, I think the science is so to summarize that, I think the science is very weak on this. But again, if you're looking for something that you can use topically, you don't need to see a provider, physician, or have a conversation about, the erections or erectile function and ways to improve it, including a comprehensive approach such as adding this, then this is one way you can do it, because you can do it over the counter, buy it on Amazon, and not have to have a conversation with the doctor about it. So,
But let's be real, guys. You should just have the conversation. I mean, come on now. We're going to spend $100 on something that 10, 12 of the first reviews I read said it made my penis burn, or a medication that actually works that's backed by science. Or, if you want a more natural option, offices like ours have natural options for patients as well, not gas station pills and Amazon gels. And perspective, icy hot drops temperature to cool by 1.7 degrees Celsius. This is 10 degrees Celsius. That's an 18-degree change in Fahrenheit. I can't even imagine what that would feel for you all.
Well, and
do it at your own risk.
So that again, though, it's like
it's crazy.
So that's a claim on the Eroxon site, right?
That's
a
it.
claim. But
10
no
degrees Celsius.
studies. So the studies that they're talking about, they're doing like a shim score, like the erectile index.
True.
And so they're using a scoring system, and it's a minimally clinically improved score. So you have to minimally improve, and it's a subjective. So I see nothing about temperature monitoring, but the claim on the website is a drop by 1 point. I wouldn't have touched any kind of approval with this.
That's the best idea.
Yeah.
Alan's listening. Alan, we're going to get it. We're going to do a shim score. You're going to use it, and then we're going to shim score you again.
Yeah.
And see what happens.
Yeah, we're gonna see
we'll
if it works.
We'll put some science to it.
Yeah, because again, there was no science actually stating that there was a study with a temperature drop or histologic effect or nitric oxide or what. And again, some of those things may just be subjective, and that would be good enough. But clearly, better studies than are on their website. The other one was again a placebo versus Eroxon. And placebo does show to have effects, positive effects for ED. So
Right?
what
'Cause
does that
guys, it is a little
say?
bit in this brain too,
Yeah.
sometimes.
Yeah, I mean, definitely. If you lose an erection during sex and it's affecting your sexual function, the first time that happens, you're thinking about that the next time. So there is a psychological component to it, and a placebo working sometimes shows that, right? Because, and actually, if you're still having nocturnal or morning erections and you're having erection issues with sex, that also will tell you that there's some
Something
sort
more
of,
psychologic than
yeah.
actually physical.
Correct. So their study versus placebo, 37% or right around there, 35 in the 30s, got improvement with placebo versus 48%.
Yeah.
So all you could actually summarize with that study is that it was better than placebo. So
Barely.
yeah, barely.
Barely.
I mean, if placebo was in the 30s, 37%, and they were 48%. So literally, you're still talking 48% are minimally clinically improved with a score improvement of 4 or 5, I think. There might be an exact number, but minimal.
Clinical improvement.
And placebo was 37 and it was 48. So weak again. That's all I'm saying. So I think that it
This is
wouldn't
a
be
bust.
something, it wouldn't be something that I would feel strongly, but if you guys give us feedback that says something different, then we're all in and reading it and getting feedback, and then we can actually even do video that kind of summarizes your experiences. So
Yeah, because at this point, it's definitely not something I would recommend to one of my patients coming in as something to use. One, cost is high for it. Two, no positive reviews. Three, the information
it's
is
a little better than placebo.
it's a little better than placebo. The study and the science is weak, so I just don't see this as being a positive.
Yeah, and going further, like your temperature drop that they state would be pretty uncomfortable. Icy hot doesn't drop it to 1/5 of that. And yet it burns when people put it on topically, per our camera guy. And not that he did that
Because
on
he
his
knew that was a
genitals,
no-go.
But yeah,
He knew
because
that was
he
a
knew that was a
no-go.
no-go. But topically on the shoulder area or wherever, non-genital, it drops and it was uncomfortable. But then again, you're talking about wanting sex, and in those studies they were to have sex at least once a week for 4 weeks, to give that improvement score. So you're talking about sex or oral sex, and again, we don't know about oral ingestion. It doesn't have an active ingredient, so I'm assuming
No,
probably safe, but
that's
does it
it.
taste good? Is it going to leave a taste in your mouth?
On the
You know.
website, it says that in their biological testing, it's safe for oral, but there was no study done on that. So be very careful what you're reading and what you're purchasing, because that doesn't really mean anything. It wasn't studied to say it's safe.
Yeah. Well, and again, I
It's
think
loose.
it's probably more, is it palatable? Because it doesn't have an active ingredient. That it says on the website.
Yeah,
Like it
that's
doesn't
true.
have, and so without an active ingredient, it's probably not going to be harmful, but is it going to be gross? And is it
Well,
going
what
to cause
about
vaginal
female
irritation?
effects?
Yeah.
That's it. What
Yeah.
about your partner?
I mean, we already know that lubes cause issues and they basically have to be pH adjusted. Vaginal preparations need to be,
pH
so
adjusted,
toys
yes.
can cause issues. So, like, again, so that can easily cause vaginitis and no mention of that, which is a problem for us as women because it easily can happen. So, anyhow, those are little things. Our summary is yes, it's a bust. That's our.
Bust.
But give us your feedback. And again, if you want to hear anything else, let us know because we're willing to deep dive into anything sexual wellness or wellness.
Thank
Thank
you.
you.